Good afternoon or good morning, depending on when you're getting the opportunity to listen to this webinar, because not everyone's available at the time that it's being presented. So this is being recorded so that it can be posted on the website for people to either re-listen to or to watch for the first time. So we wanted to make sure everyone who wished to would have the opportunity to watch the presentation. And this is one of what will be a series of webinars sponsored by Parkland Community Health Plan Quality Area, where we're hoping to help you promote healthy living regardless of whether you're an adult, child, infant. So anyways, with that said, I am going to go ahead and share my screen. There we go. Let me go ahead and start the slideshow. Okay. So as I said, this is a webinar sponsored by Parkland Community Health Plan, the Quality Area. This is prenatal and postnatal care with some discussion on various conditions and social determinant influences. And the goal and the purpose of this is to assist in promoting a positive pregnancy and happy, healthy mom and baby afterwards. Okay. So just a little overview. We'll have a little introduction in just a second. We'll talk about some social determinants, and then we will talk about some pre-pregnancy, prenatal, and then postnatal, postpartum care. And this will not or should not take a full hour. So, okay, just a little quick introduction about myself. My name is Laura Kibbe. I am a registered nurse, and I have been a registered nurse for over 30 years. My primary background is in medical. People come in, they're not 100% sure what's wrong. They've got a stomach ache, they've got a respiratory infection, so have been fortunate enough to work with them to get better. Some other areas that I've got some positive experience in is orthopedics, inpatient rehab, pediatric home health, and I completely and totally enjoy hospice. I also am a nurse educator, and I am not an OB nurse or maternity nurse. However, I am the mother of 4, grandmother of 1, so I do have some experience with being around infants and children. And I also had the good fortune of being my sister's birthing coach as well as my daughter's birthing coach. So I've got a little bit of experience on some of that stuff. So let's get started with some social determinants of health. And, what is that? So let's go ahead and define that real quick. Okay, so the Centers for Disease Control and Prevention, the CDC website, defines social determinants of health as conditions in the places where people live, learn, work, and play that affect a wide range of health and quality of life risks and outcomes. Okay, so that's a mouthful, so I'm going to go ahead and say it again. Social determinants of health are conditions in the places where people live, learn, work, and play that affect a wide range of health and quality of life risks and outcomes. Okay, so they're what influence us, that are positive and negative. Okay, and usually when we're talking about a determinant, it's can sometimes have a little bit more of a negative impact if we don't do something about it and if we don't work together. So some in general topics or categories for social determinants include economic status and income level. How much does a person make, or how much income do they have coming in to help pay for the bills and put a roof over their head and things like that. And then we have race and ethnicity. And I am going to apologize because every once in a while I will probably glance over to my side a little bit because I've got a couple little notes so that I don't miss anything. Okay, so race and ethnicity. Sometimes those words get used interchangeably. They're not 100% the same, Race is a divide basis of various sets of physical characteristics and social naming. So it's more our physical, men, women, color of our skin, and things like that. Then when we talk about ethnicity, we're talking about the culture of people. It can be based on geographical region and include things such as language, heritage, religion, and other customs and cultural things. Okay. So then another social determinant of health is religion and culture, because our religion can impact us. As we know, certain religions allow or don't allow certain things when it comes to medicine. So that definitely would have an impact on taking care of a patient or a new mom and things like that. Our educational level. And of course, we have to look at not just the education here in the United States, because we are fortunate enough to have an extremely diverse population, which is wonderful. So we have to take into consideration and think about people that have not necessarily been born and raised in the United States and have not gone necessarily to school in the United States. Other countries, they'll do grades, what we would call K through 8, and then in ninth grade, which would be high school for us, they would begin college type courses and things like that, or they may go directly to work study or something like that. So we have to look at different educational levels and things that are within our culture and our environment that can also have an impact and social determinant on our health. Age, of course, young, old, and in between. And then some health considerations like medical insurance coverage, access to medical care. Is the person able to go to a doctor or a clinic, or do they always get stuck having to go to the emergency room or something like that? And then some general and pre-pregnancy health status are all different determinants that we have. Now, when we're looking at some social determinants of health for young pregnancies, and young pregnancies are usually defined or as 15 to 19. So our teenagers and adolescents and things like that. But this can go down as young as 10 years old, because the determinant or determining factor of a person getting pregnant or not pregnant is when they start their menses or start having their period. So if we have a girl that has started her period at the age of 10, well then, if she has intercourse sex, then she could possibly potentially become pregnant. So, we're looking at that. And the concern is that in January of 2020, I'll throw a few statistical numbers out here and there, but not too many, don't worry. Approximately 12 million young girls, or at least 777,000 girls under the age of 15 in developing regions. Or, I'm sorry, I said that wrong and I apologize. So there's approximately 12 million young girls in the world. And of that, 777,000 under the age of 15 were pregnant. Okay. And one of the things, or one of the concerns, perhaps not as much here in the United States, but globally, is that young pregnancy, girls 15 to 19, it's a leading cause of death. Okay. So other things to look at when we're talking about young pregnancy: poverty. If they have not finished school, like you said, the age is 15 to 19. So you've got some, a little bit older that are working age, but usually, when you're 17 and 18, you're not getting, slightly better paying jobs. You get the jobs at fast food places or restaurants, not that any of those places are bad, but it is difficult to maintain a household, because unfortunately their pay scale is not where it should be. Also, family. Family is a social determinant for young girls or young pregnancy, because depending on how many siblings they may already have, if they have a family that has, two parents, or if it's just one, are they even raised by parents? If something's happened, and they're living with someone else. Family is dynamics are multiple and different and very unique on each individual basis. Other considerations: access to healthy food. If they're living in poverty, their source of nutritional food can be a challenge. Healthcare services and primary care, employment and employment status, which I kind of already touched on with the poverty. So, just a little bit of a comparison is basically all this slide is to show like the general and then, some of the differences with the younger pregnancies. Money is of course still an issue depending on what a family or person's income is. But there's a little more emphasis with the youngers on doing things like family and healthy eating, where usually people a little bit older, over 20, will perhaps have a little bit better income and things like that. But something that we want to take into consideration and look at, because pardon me, the goal is to have healthy pregnancies. So then we have healthy babies. So why do we care so much about these social determinants and the influence that they may have on a pregnancy? We have risk factors. Okay. For adults, one of the biggest risk factors for adult women who are pregnant or considering pregnancy is obesity. America, we are overweight. And with being obese, we have complications such as high blood pressure and diabetes. Okay. Besides usual things like, a little bit less, lack of energy, pardon me, and things like that. Another risk factor: smoking and alcohol consumption can impact both the mother and the infant. And it also, especially with both the smoking and the alcohol, can lead to premature births, which then means babies can be in the hospital for a longer period of time, can have birth defects and or lead to death of the infant. Women in childbearing years don't take enough folic acid supplements. Are obese, take prescription and over-the-counter drugs, which increase the risk of birth defects. Anything that we consume in can affect a baby. So if we're not eating well or we're taking drugs or medications, whether they're prescribed or not prescribed, can affect our baby. Folic acid, let's talk about that for just a second. Now, I don't encourage anyone to take anything without consulting a physician, especially someone who is considering getting pregnant or maybe pregnant. Always talk to your healthcare provider. Okay. They know you better. You know you better. And you want to be followed and monitored. But folic acid, which is also known as folate and also known as vitamin B9, is one of those things that help with the development with brain and spinal cord and things like that. So that's where it helps with reduction of some birth defects, such as spina bifida, the malformation of the spinal cord in babies. So foods that are high in folic acid include things like broccoli and nuts and beans, and high grain and spinach. So we've got some natural things that we can do, but also, again, under the supervision of a physician, it's always encouraged to possibly be taking some supplemental folic acid. And that, of course, can be bought over the counter, but again, with the guidance of a healthcare provider. Another risk factor when we're being influenced by some of our social determinants, if we, have a lower income or, we are young or old or whatnot, is depression. Okay. And this is a really common problem or concern in the last trimester of pregnancy and also within the first year or so after delivery. Okay, because there's all these new things going on, especially for first-time moms. Sometimes even moms of more than one child will become overwhelmed when they're having additional pregnancies because of the additional responsibility. Children are great, children are wonderful and things, but they're a responsibility. So some of the things that depression can influence is our ability to perform activities of daily living, our routine activities, getting up and getting showered, getting up and getting dressed. If you're depressed, you have a low energy supply. And so you don't feel like doing things. Okay. It can interfere with our bond with our child, and it can also interfere with how we interact and relate with our family. Now, for infants and children with of influences, risk factors from the social determinants, um, is leading cause of death, birth defects, and preventable proper prenatal care. So if a mom, is being influenced by some sort of social determinant, they may not be getting the care and things that they need for having that baby. Okay. So we want to make sure that mom is getting what she needs, because if she's getting what she needs, it helps with the baby in the long run. Obese women increase the risk of having an obese child and developing type 2 diabetes. Okay. So, you know, if we're heavy set, and you kind of think of people that have you known a woman who was a little heavy, and then you notice that the baby, and or as the baby gets a little older, it tends to be overweight as well. And then of course, again, it increases the chances of type 2 diabetes. If there's not health care, that a person doesn't have health insurance, or very limited, they could be missing newborn appointments for their child. Okay. The missing the appointments can help with the detection of things like hearing loss and sickle cell. Things that get tested on routine newborn appointments. And of course, these appointments, they're a little cumbersome, especially that first year, and they'll go until they're at least 2, as far as like very routine shots, and then does get a little bit more better spacing before they go to school, but still, and immunizations. Okay, immunizations protect against 14 preventable diseases. Okay, chickenpox, measles, mumps, things like that. Um, It's everyone's right to choose whether their child does or does not have immunizations. They put themselves and others at risk not getting the immunizations, um, because even if they don't end up contracting these diseases as a child, which usually, back in the days, people had chickenpox and measles and mumps, and they survived and, did okay. But as a person gets older and older, if they've not had exposure and then all of a sudden have exposure, because there's not 100%, like when we get the flu shot, there's not 100% guarantee you're not still going to get the flu. There's not 100% guarantee you're not going to get chickenpox or measles. The benefit of getting the immunizations is it builds up our immune system. So then if we do get exposed and we do get the diseases, it's not as severe as it could be. If we get these diseases when we're adults, you're sicker, and it increases the risk of death. Okay. So it's especially important if you have a child that's high risk. For example, if a child has Down syndrome, they need some of these immunizations to help them stay healthy. Okay. So let's talk about pregnancy care. We got that positive pregnancy test. Okay. First, let's talk about pre-pregnancy care. Okay. Getting ready for conception, getting ready to get pregnant. If you're given the opportunity to kind of plan ahead and think about, wanting to get pregnant and having a baby, and then, getting prepared for the delivery, all the different things that can happen and not happen, and then the postpartum care, the care that you receive afterwards. Okay. So we want to be healthy. We want to consider what our current health status is. And some of this we've kind of already talked about a little bit. Okay. We want to make sure that we're living healthy. Okay. That we are in a clean environment. Okay. You don't have to be a millionaire to be clean. Make sure that there's, open spaces, that you've got room, that you're getting food. We talked about weight. we still want to make sure we're eating those different food groups, getting the proteins and the vitamins, minerals, getting our carbs, everything that's needed for the body to function well, and maintaining exercise and activity and things like that. Make sure our immunizations are up to date, like I mentioned about the flu shot. You know, the flu season comes and goes. We've now got COVID, that and another virus that we've got to deal with and work with. So keeping our immunizations up to date help us to stay a bit healthier, so that um, when we are pregnant, we don't have to worry about being sick, and we don't have to worry about baby getting sick. If we happen to have a medical condition, someone's diabetic, has high blood pressure, has COPD, asthma, things like that, it does not mean you cannot have a child. Does not mean you cannot get pregnant. It just means you need to make sure your condition is controlled and that your doctor's aware, so that because you may need some changes in your medication a little bit to keep yourself healthy and to keep baby healthy. Family history for you and your partner. You want to find out, what kind of childhood issues have been in your past or in your partner's past. Is there anything to be concerned of? We talked about, um, and down in below it says, for your own mental health, depression, anxiety, and other mental health illnesses, you want to make sure you're getting that monitored and checked. Well, you want to know, is there, depression or something in the family, so that, no, not when you have an infant, but as you're going along and watching your child grow and develop, you'll be able to learn and make sure that if there has been any issues within the family, you can be aware of it, to just watch for it. If you happen to be a smoker, vapor, um, and chewing tobacco, sorry, drink alcohol, take drugs that are not necessarily good for you, you want to try to stop that. Okay, you want to try to reduce it at the very least, or quit it completely, especially things like, smoking and any drugs and things that are not prescribed by a physician. And of course, we don't want to drink alcohol, because that, of course, can intercede with and affect the baby's growth. Okay. Prenatal care. So now you found out that you're pregnant, and you're dealing with the funness of pregnancy, which, there are days, ups and down days, and times during pregnancy. There is things like morning sickness and low energy and some mood swings and things like that that come with pregnancy, but they all pass. Your hormones are going a little bit crazy and stuff like that. So we wanted to make sure we're reducing the chances of complications, though, for mom and baby. So we're wanting to make sure that mom is getting diet, exercise, taking vitamins, especially like I already mentioned, the folic acid and the vitamin B, and you're getting monitored. Okay, this is where those social determinants start to play that nasty little thing too, because you want to make sure that you are able to go and get your routine checkups. You want to be sure that you are getting the tests and things done that are required to monitor the safety of yourself and the baby. Okay, there's that wonderful glucose test that everybody talks about that you have to take during your pregnancy, which, no, it does not taste good, but it will let you know if you're having problems with gestational diabetes. And if you are, then that can get monitored and taken care of, so that it doesn't cause problems for you or your baby later on. Okay. We want to make sure that, because we're doing all these other things, that we're making sure that mom is diet, exercise, and things like that, that baby is being protected, to reduce any problems that can happen during or after delivery, such as sudden infant death syndrome or fetal alcohol spectrum disorders. If a mom has problems with drug addiction, okay, baby can be born addicted to those drugs too. So that's why we say, if you are thinking or considering or find out that you're pregnant, stopping all those things are very important and essential, not just for you, but for your baby as well. Okay. Let's see, make sure I didn't miss anything with that real quick. Okay. So, postnatal and postpartum. Now, postnatal primarily means baby. Postpartum is pretty much mom. Okay. And this is the time after you actually have delivered and you are holding that happy, healthy baby boy or girl. Okay. This is those first 24 hours to the first 6 weeks. And usually, we say the postpartum is the first 6 weeks because generally, especially after a vaginal delivery, you get your follow up at 6 weeks. And usually you're good to go as far as being able to go ahead and go back to like semi normal life. Of course, you have a baby now, so doesn't go back 100% ever again. Um, and then these are like important times for the baby too. It's very important to make sure you get the baby checked um, when their appointments are due and things like that. Um, And okay, I was going to go on to something that's on the next slide. Wait a minute. Support person. You want to make sure that you have someone with you for the first 24 hours. Okay. Generally, after a vaginal delivery, you can stay anywhere from 24 to 72 hours, depending on what time your delivery is, how you're doing, how baby is doing. There's a lot of people that have births now in birthing centers, which they'll just stay for a few hours after the baby's born. Or they'll have home births as long as baby and mom are both doing very, very well throughout the entire pregnancy. So if that's something you would want to consider or think about, then you need to make sure that you're able to make doctor's appointments or see your health provider to make sure that everything's going how it's supposed to. Because if there's any sign that there might be even just a hint of a chance that anything might go wrong, even if it's something really small, then you want to make sure that you've been seeing someone so that you don't start a home birth and have to be rushed to the hospital. Um, so you want to have somebody around. You're not going to be moving quite as fast as a general rule right after you have a baby, whether it's a C-section or a vaginal delivery. You want to make sure you schedule and go to your postnatal visits for mother and infant. Like I said, the baby needs to be monitored and making sure that they're growing and gaining weight and not having any problems eating and things like that. Mom needs to be checked to make sure that everything's healing well, whether it's a vaginal delivery or a C-section. You want to make sure you're healing and that things are going the way that they're supposed to be going. Okay. Nutritional intake for mom. Okay. Especially if a mother's breastfeeding, you want to make sure you're increasing your fluid intake because you've got this child that's going to nurse depending on the age, the size, and their appetite. The first few days, every 1 to 2 hours, 1 to 3 hours if you're lucky. Um, so you're going to want to make sure that you have fluid so that you can produce milk. Okay. You want to check with your healthcare provider about normal versus abnormal bleeding. Okay. Whether you have a vaginal delivery or a C-section, there is bleeding afterwards. You just had something out of your body. Usually the bleeding after a C-section is a little less than that of a vaginal delivery. I think that kind of makes sense. However, there is still bleeding. Okay. The products of birth have to leave. Okay. You want to make sure you are getting rest and sleep. The golden rule: when baby rests, mom rests. Okay. Especially during those first 6 weeks. Make sure you're getting plenty of sleep. Your body's just gone through a major traumatic, positively traumatic, but a traumatic event. Okay. And you don't want to do a lot of heavy lifting or anything like that right after having a baby, regardless of, again, whether it's vaginal or a C-section. Your body needs to heal. Back in the golden ages or before the wild, wild west, women would have a baby and within a couple of days be back out working. They also didn't live as long as we do because they would start doing things to their body before they were supposed to. Okay. Okay. Some more prenatal, postnatal care and things. Hygiene. Okay, so we kind of talked about the bleeding. You want to make sure that you're monitoring pads and that you're disposing of them carefully and correctly. And you want to make sure if you had an episiotomy or if you had a incision from a C-section, that you're, cleaning it and monitoring it and watching it for signs and symptoms of infection. Okay, things like, as far as the C-section, if there's like a discharge, if there's an odor, if you notice funny color, the same thing with the episiotomy. If you start noting a foul odor or, any kind of weird colors or anything like that, you're going to want to contact your healthcare provider. And you want to make sure you've discussed all this with your healthcare provider before you leave the hospital. Make sure that there's nothing specific that they want to know about. Okay, sexual relations. Okay, so you're going to want to be careful and not start having sexual intercourse prior to being released from the doctor saying it's okay. You've got a higher increase of getting an STD and things like that, sexually transmitted illness. HIV, of course, that would just depend on whether your partner or you are infected. Wound healing, we kind of already talked about, but if you start having intercourse before the physician says yes, then you could cause some increased problems or concerns. If you had an episiotomy, you can end up ripping that open. That's not something you want. And you want to think about family planning. Some people, they plan on having, 10 kids. So they, that's their planning. They know they're going to have kids pretty steady for a while. That is wonderful. But that's something you want to think about and consider. How many children might you want? Are you going to want to do something about birth control? Or are you not going to want to do something about birth control? Things that you need to discuss and determine with your healthcare provider and your significant other, spouse, whatever. Okay. Home environment. We want to make sure that we've got some control. I'm sorry. Temperature control and ventilation system is good, and that you've got good clean water and things for you and for baby. Something to consider when wrapping up and bundling your new little one. Think about how you feel. Okay, if it's 110 degrees outside and you're sweating to death, baby may not, when they're inside under air conditioning, may need to be kind of wrapped up. But if they're outside, you may want to take a look at them and make sure you're feeling their skin, checking to see if their cheeks are flushed or anything like that. The first few days, they probably do need some extra bundling, but not in an excessive amount, depending on the temperature and the conditions. Okay. If you're starting to get really, really hot, baby could start to get really, really hot. Like I said, it may take a day or two for them to kind of regulate that way, but you just kind of watch them. Okay. Um, Infant feeding, breast versus bottle. Major debates all the time. What is the best thing to do, breast or bottle? I am not here to solicit for either one. As I mentioned in the beginning, I had 4 children, or I have 4 children. Um, 2 were, one was 100% bottle fed because back when she was born, it wasn't necessarily a big thing or a big deal. There was no nursing rooms or anything like that. So she was bottle fed. Okay. The others, one was, didn't do good with the bottle. The other 2, breastfed, at least for a little while. All 4 of them are very healthy. They really had no extra health issues or problems, the bottle versus the breast. It's what works for you. If you give yourself extra pressure to breastfeed, I'm going to warn you that you possibly could have some problems. And that's just because of anxiety. You get yourself all worked out. Have to breastfeed, have to breastfeed. If it's something that's not what you really want to do, no, you don't. You talk to your healthcare provider. Okay. Talk to your significant other, whoever your support systems are. The only thing that matters is that baby's getting positive nutrition and growing. Okay. Are there some health benefits to breastfeeding for at least a few weeks? Yes. Okay. There's a little bit of, pluses that they can get from mom if they breastfeed. If they don't, is it totally the end of the world? Absolutely not. Okay. What works for you? Do not compare yourself to someone else. Make sure you're doing what's best for you and for baby. Okay. So enough on that little preachy episode. Sorry about that. This is the only thing that matters is a healthy baby and a healthy mom. Okay. We want to have the 10 fingers and toes. Okay. Nothing's cuter than the baby's little fingers and little toes. Okay. Good skin, happy smile. Okay. Being able to eat. Okay. That's what's most important when you make your decisions. What works for you and what works for your baby. Okay. Yeah, you do kind of have to consider the other family members if, depending what your family consists of. Most important when you're looking at pre-pregnancy, pregnancy, and post is you and baby. Okay. Now, if you have additional questions, if you need additional assistance, if something comes up a week from now or 10 days from now or 2 months from now after whenever you happen to see the webinar, that is my name, my phone number, and my email. I am always available to take a question. It may take me 24 hours to get back to you. But I am always happy to answer questions. And if I do not have the answer, because I do not have every single solitary answer in the book, I am more than happy and willing to find the answer for you or help you find the answer. Okay. If you happen to be a member of Parkland Community Health Plan, if you are a STAR member, the phone number is right there. If you're a CHIP member, the number is right there. If you are not a member, you can still call me and reach out to me. That's not just limited to Parkland Community Health Plan members. Okay. If you have a question and may want to consider or find out if you're eligible or how to enroll in that either one of the programs, feel free to call one of the numbers and they should be able to direct you to the right person. Okay. And then if again you have any questions, just feel free to reach out and let me know. I want to thank everyone very much for listening. Some of my resources, I do try to make sure that I am using government resources and peer-reviewed literature before I give out any information. And I do tend to use a few resources to make sure I have the best information. So again, thank you very much. Let me stop sharing my screen real quick. Okay, I appreciate your time. And again, if there's any questions or anything I can do, we are going to continue a series and continue to talk about things for pregnancy, maternal well-being, and then also some things for adults in general. Okay, I hope you have a wonderful day and thank you again. Goodbye.